All right, so I am going to take time to welcome you all to introduce the team that we have joining us tonight. And so I am Pam Workington, and I'm with the Take Action on Radon program. Uh, and I am joined by my colleague Erin Curry, also with Take Action, and Dr. Anne-Marie Nickel. She is our epidemiologist tonight. And also joining us is Tyler Black from the Wellington Dufferin Public Health Unit. So really thankful for Tyler to be able to help connect us with your community and facilitate the program. And then also Rashid Suleiman is joining us from Health Canada. He too will join us at the end to help us with answering questions. So great resource to have joining us tonight. And then I also would like to start by introducing you to Bonnie. So many of you may know Bonnie. She is one of your neighbors, and she reached out to the Canadian Cancer Society, which is one of our lead partners on the Take Action on Radon program. Bonnie shared her story with the Canadian Cancer Society, and when we heard her story, we thought, well, let's help her. She had an interest in sharing it with her community and doing radon awareness, and so it was Bonnie who brought this program to your community, and then of course with Tyler's support. And so I'm going to hand it off to Bonnie, and she's going to share her story.
Okay, good evening, and my name is Bonnie. So my story started in 2022. I was diagnosed with stage 3 lung cancer. It came as a great surprise as I was a non-smoker. During the initial appointments with my oncologist, it was like, why would I possibly develop lung cancer? So the comment that he made was that there is a direct link between, of course, smoking, but he also mentioned the second link was radon. So it sparked my interest, and going along, thinking about the radon, we lived in one house for 30 years, and knowing that the 2 residents died of cancer, again, not knowing the immediate cause or what the link was, or if there was even a link, I decided that I should test our home where we've been living for 6 years. And the first test showed that we had a very high rating of radon, which really surprised us. So I thought I need to make this a bit of my mandate. I started talking about it to different residents where we live, and people were kind of shocked, like, what is radon? What's that all about? There was so much unawareness of radon and radon testing. So we had invited Tyler to come for a talk to our community. We had a good turnout. There were quite a few people. In the meantime, and I don't know whether, Pam, you're even aware of it, I was invited to, it was called the Pan-Canadian Lung Action Plan, which was held by the Canadian Cancer Society in Toronto last year at this time. And it's been 2 years in the making, and they put together a 2-year action plan. So the first thing, and it was just published about a week ago, through the Canadian Cancer Society. And the first action plan is actually to reduce exposure to environmental hazards. They're trying to reduce the cancer rates. Mortality for cancer in Canada is one of the leading death rates of any of the cancers right now. So they're trying, their mandate is to reduce it by 30% by 2035. So an action plan is in place, and the number one is reducing the carcinogens in our environment, and radon is top of that list. Statistically, 17% of lung cancer non-smokers, which is what I was, have been linked to radon. So here I am trying to advocate for more radon testing. especially starting in our community.
Thank you so much, Bonnie. Yep. Yes, I was at that event. Yeah, thanks for sharing that. And we will share that link out in the follow-up emails. So yeah, thanks for letting us know. All right, I am next going to hand it off to Dr. Anne-Marie Nicol, and she's going to get us started to talk about what radon is. So Anne-Marie, I'm going to hand it off to you.
Thanks, Pam. You can hear me okay?
Yeah.
Yep. Excellent. Well, thank you all for joining us this evening, and thank you, Bonnie. It's always, in many ways, radon is an invisible problem until folks like yourself actually make the connection between exposure and outcome. So I really appreciate your opening our session tonight. I'm just going to talk quickly about what radon is and how it impacts health. And then I'm going to hand it back over to Pam. I'll talk a bit about testing, but Pam really is the expert on how to fix a house. And then we'll go over the 100 test kit challenge nuts and bolts of the people who are going to take the test kits home. We do have a Q&A section, this, again, and a chat. So please feel free to put your questions in there. No question is too strange for us not to contemplate. And I mean, it is about radiation and lots of people have questions. And then just to say, this is a national program and we're proud to unite people from across Canada, which encompasses the traditional territories of many First Nations, Métis, and Inuit people whose footsteps and rights extend beyond the colonial boundaries that we have today. So we respectfully honor these people's rights and histories and their relationship to the land. And I'm calling in from the unceded territories of the Musqueam, Squamish, and Tsleil-Waututh people on the very west coast of the lower mainland of British Columbia. So as Bonnie noted, radon gas exposure causes lung cancer, and it is clearly the leading cause of lung cancer in non-smokers, and then it's considered the second cause of lung cancer in people who smoke, because there is sort of an additive relationship between the two exposures. And what we're seeing in BC is more and more people, unfortunately, like Bonnie, people who have looked after their health, their lung health, people who are younger, people who are women, who are being diagnosed with lung cancer and never were smokers. And so I think I really appreciate, Bonnie, you're addressing this issue, because these are people who are often quite surprised, or in the case of younger people who just incidentally find out that they have lung cancer, and then they're shocked. Because they never thought that they were at risk, and they never would have received any diagnostics anyway, because they don't fit the criteria of what we have historically considered to be a lung cancer patient. So the more awareness that we can raise, it's not just smoking that causes lung cancer, that there are other exposures. Everybody knows about asbestos, but radon gas and exposures to other metals can also contribute to lung cancer as well. Next slide, please, Pam. And we clearly know that radon causes lung cancer because of the experiences of people who worked in Canada in uranium and hard rock mines, as well as people in the United States and Europe. Over the last 60 to 70 years, that it was very clear that the exposures these people received resulted in lung cancer diagnoses. And as a result, all around the world, the IARC, which is from France, the WHO, and other national agencies, including the EPA and Health Canada, clearly flag radon gas as a carcinogen. And if you've not heard about it until today or recently, then you're not alone, because Statistics Canada does a survey every few years along with the census. And it asks, some people get asked extra questions, and on those extra questions is one that says, have you heard of radon gas, and do you know what it is? And so less than 50% of Canadians are still aware of what radon gas is accurately. So the fact that you've come tonight means that you're all going to do much better on the census if you get those questions the next time it comes around. But just to say that even though it's known clearly in the scientific community that radon gas exposure causes lung cancer, it's not as widely known outside of the medical and scientific world. So to try and contextualize this for people, Health Canada estimates that about 3,200 people actually die each year from radon-related lung cancer. Next, please, Pam. As I mentioned before, radon and smoking are two exposures in the lungs that, when happen concurrently, really dramatically increase people's risk of developing lung cancer. So if you smoke or you live with a smoker, it's a really important step you can take to reduce your lung cancer risk. If you have high radon, your risk of developing lung cancer is about 1 in 20. But if you smoke, it goes up dramatically to 1 in 3. And there is a combination of the two exposures together that make things far worse for the lungs and their ability to repair themselves. So we like to say radon and smoking don't mix, and it's far easier to test and remediate your house than it is to actually quit smoking. Next. In BC, we try to give numbers to these estimates, and what we've shown is here, the column on the left is the radon level, and radon is measured in becquerels per meters cubed. So that's cubic meters of air, and becquerels is the disintegration of radioactive decay. And so if you are under 200, which is the Canadian guideline, this is considered to be a level at which you don't have to take steps to fix your home. But over 200 and above, the risk goes up. And what you can see here, as the table goes down, the numbers get bigger. So the more radon that you are exposed to, the greater the magnitude of your risk. And if you smoke, you can see it's significantly higher than if you are a non-smoker. But we still see a 4% increase in lung cancer risk at 600 becquerels. I would like to say that that is an uncommon number, but that is not the case in my province. In particular, we have a region where finding numbers like that is not necessarily uncommon. Next, please, Pam. So how do you get exposed to radon gas? None of you, I'm sure, are uranium or hard rock miners. So how would you be exposed? And that's because radon exists in the soil. It's a soil gas, and it's actually pretty much ubiquitous across Canada in some concentration or some degree. But there are parts of our country that have more radon gas naturally in the soil underneath our homes. And radon is a gas and gases do what gases do. They like to move. So it likes to leave crowded, cold places and go to warmer, more open spaces, which means that gas is going to try to migrate up out of the soil. And anything that's built with soil contact is eligible for radon to come through cracks or gaps in floors and walls, sumps and drains, spaces that are gaps around drains and pipes. And we tend to see that the levels are generally higher in the basement and ground contact rooms, but we can also see elevated levels in second floor rooms or even in apartment buildings, depending on how buildings are heated and treated. Next, Pam. So where is radon a concern? It's a concern in homes. And we know that as people spend more time in their homes, there's a recent survey that was done that said that Canadians spend 90% of their day indoors. And of that, about 70% of their time at home, although that went up during the pandemic and has not gone back down since. So a lot more people spending a lot of time at home. But really any building that has the potential to have ground contact, so that includes schools and workplaces, can have elevated radon levels. And you can ask, the federal government has tested all of its workplaces, and you can ask about that if you are a federal government employee, but you can also ask your employer if they've tested the space that you work in, if it is one that is basement or ground contact, or actually any workplace, you're allowed to ask to see if it's safe for you to breathe the air inside. But as a result, Health Canada recommends that all buildings, homes, workplaces, schools, libraries, and otherwise be tested for radon. So how do you test for radon? Well, as I mentioned earlier, unfortunately, it is an invisible, odorless, colorless, tasteless, invisible radioactive gas. So you can't guess how much is in your home. Indeed, your neighbor might have a high level and yours might not be. Each home and its relationship with the ground is very different. How people use homes are different. If people leave doors and windows open, generally, or if you're one of those folks that's tightened your house up a lot with energy efficiency initiatives to keep the warmth in, all of those different factors can influence how much radon is in your home. So the only way that you can know is to actually test. And there are different ways of testing. Pam will talk to you tonight about the kinds of tests that we use, which are very accurate. And there's smaller ones that don't require a plug-in, but they're single use. But there are also more expensive digital monitors that you can get, and sensors that even fit in and test other contaminants as well. So, but the long and short of it is that testing, and in particular the testing that you're going to do, is quite accurate, and the levels do fluctuate over a 24-hour period because, again, it's a gas, so gases move around when things are warm and cold. And what we see is that radon can actually really fluctuate during the day and over time. So we don't want to know what the worst radon level is in your house, and we don't want to know what the best radon level is in the house. We want to know what the average is, because that is what's used to extrapolate your health risk. So because levels can fluctuate so much, the federal government recommends that people test for a minimum of 91 days to get a good picture of what the radon levels are in your home. And this is also why we suggest people test over the heating season, because it's more likely that they'll have doors and windows closed. And that way we can tell what the average concentration is for you over that period of time. So the radon detectors that we use are called Alpha Track devices. And again, they are reliable, but they're one-time use. They don't require batteries. They don't plug in. They sit in your home and they breathe the same air that you do for that 91-day period. And they're actually the most accurate kind of testing device. Some of the digital monitors come close, but they're $250 each, and these are not. So we also follow quality assurance measures to confirm the accuracy of our test devices, and Pam will explain what that means when she comes to talk about the actual test kit giveaway, because some of you will participate in that accuracy and QC/QA process. And I think I'm handing it back over to you, Pam, or would you like me to keep going?
Nope, that sounds good.
Okay.
Yeah, so as Anne-Marie said, the tests are long-term, and so you will be testing through the heating season. So we talk about 100 days because it's easy to remember, but ideally we would like a minimum of 91 days. And at the end of that, you'll get a report that will give you the radon level that was the average while the detectors were in your home. When you get that report, you'll see the number, and Health Canada recommends that if your radon level is above 200 becquerels per meter cube, that you reduce it, and that when you do take action to reduce it, that you reduce it to as low as possible. Now, we do have a national certification program in Canada, so you can go on at the CNRPP website to find a list of mitigation professionals to help you if you do need to reduce it. But it is a simple system. So radon mitigation is the most effective way to reduce your radon level. And this involves a pipe and a fan that provides a pathway for the gas to go from beneath your home up and out of your home. And so it's a simplified picture here on the screen, but it's meant to represent your home. So in your home, you likely have either a concrete floor, or if you've got a crawl space, a polymembrane. And so if you've got a concrete floor in the home, then this pipe would go through, a 5-inch hole through the concrete floor down into the subslab space below the floor. And so this is just meant to be kind of an open space below in the gravel layer or the ground that's below your home. And it provides a pathway for the gas to go up and out. And then it's discharged outside where levels reduce to quite low levels. And then there's a fan that's added, and this fan needs to be installed in a way that is the right size for your home. And so it doesn't suck the air out, but really what it does is it just provides changes of pressure so that instead of the air coming up into your home, it comes up through this pipe system and out. And it also should be installed so that the foundation of your home is also sealed. So any other cracks in the foundation, such as sump pits or, major openings that may provide a pathway for the gas up or down, in fact, for those would be sealed. And so ideally what we would like is a nice sealed environment so that when the air is drawn out of this one point, it's really efficient and it draws the air from the full footprint of the home. And so what can happen is if there are other openings, it can actually draw conditioned air down into the space below your home, and then it kind of goes up and through this. And so you don't want to lose that conditioned air. So we want a nice well-sealed area for it. Now, if you've got a crawl space in your house, then instead of a concrete floor, we can create this with a poly membrane. And so that would be well sealed to all access points and around the perimeter of the home as well. And so here's a couple examples of what it might look like. In addition to have the pipe and the fan, there's also a little manometer that's on it to indicate that the fan is working. And so this system would work continually. And again, it would be a really small fan that would just draw the air up and out. Or this one has an electronic fan on it, so it would sound off an alarm if the fan stopped working. And then, as I mentioned, if it's not a concrete floor, it could be a poly membrane. And so here's a couple pictures of it installed through a poly membrane in a crawl space. Now, the other thing to note is that in new homes, there is a National Building Code includes measures for radon. And so as of January 1st, across the province of Ontario, this has been enacted. There has been, regions that have been following this in the building code already for many years, but the building code now includes a granular layer that is underneath the slab of the home, and then a poly liner on top of that. And that provides a communication layer for the air to move throughout the foundation of your home. And then there's a pipe that's just a rough-in. So instead of it being that full pipe like I showed that would go up and out, it's just a capped pipe, so maybe about 12 inches above the floor. And then it should be capped and sealed and labeled. And so that doesn't fix the radon, but it's there in your home in case the pipe needs to be extended. So what you would do is you would test your home like you will for this program, see what the radon level is. And then if the levels are high, then you would extend the pipe up and out. And so instead of having to drill through the concrete floor, this portion is already there. So you just need to tap into it and then extend it out of the house. And so that's the current code. So there have been, homes that were built in 2025 that may have included that. Now, another thing that's in play is the Canadian Lung Association has a national mitigation grant. So if you have levels of radon above 200 and you need to mitigate, you can apply to the Canadian Lung Association Lungs Matter program for about $1,500 towards the cost of a mitigation. And this applies, in order to apply, you need a long-term test, so one like you'll get from this program. You need a quote from a CNRPP professional, and then you need a way of qualifying. So there's two ways to qualify. One is if you have income. So if you're under the median income for the province, you can apply. So it's targeted towards those who are low to moderate income. And then if another way to apply would be if there is an occupant of the home with a lung cancer diagnosis. So would be an automatic qualification as well. And so this is available for anyone in the country, again, if they qualify, and you can go on to the Canadian Lung Association website and find more information. And then in Ontario, you also have the Terrian Home Warranty Program. And this covers homes up to the first 7 years. So if you're in a home that is newly constructed, you will have automatic coverage for this. So if it's less than 7 years old and you're testing, then the Terrian warranty will provide coverage for the full mitigation. Okay, so that covers all the basic information about radon. And now we're going to go through how you can get your kit and the actual setting up your tests. So it's pretty easy. The first step will be to pick up your kit. And so I'll go through the locations in a minute. But once you get your kit, you're going to take it home, open it up. So you'll see it's just an envelope. Inside the envelope is a little detector. And there's some pictures up here on the screen of what it looks like. And then there is an information sheet, instruction sheet to set it up. And so once you take out the detector, it'll come in a clear plastic package. So you just cut open that clear plastic package and take the detector out, and then find a location in your home to set it up for the 3 months. So I want you to think about your house. Think about the lowest level. So if you've got a basement in your home, think about that basement. Think of a room such as a bedroom or a home office where you can put the detector. If you don't use your basement for more than 4 hours a day or more, then think about a room on your main floor. So again, a room such as a bedroom, a home office, a family room, where you spend 4 hours a day or more in it. And then once you pick a room, think of a location in the room that the detector can sit for at least the 3 months. So you want it at least 1 meter away from the window, and you want it up off the floor. And so ideally what we get you to think about is your breathing zone. So think about the space where you would sit and sort of that breathing space, and see if you can find a table or a shelf in that area. And if you have kids or pets and you want to put it up a little bit higher just to make sure that it sticks around for the 3 months, then that's fine. We actually found that it doesn't vary hugely anywhere in this space. So the key thing is keep it away from the window and keep it up off the ground. But other than that, you can find a good location that it's going to stay for the 3 months. Another option would be to hang it. So you can hang it from an interior wall, or you can also hang it down from the ceiling if that's helpful. So if you're moving things around, or you maybe have, decorating for Christmas and you don't want it to get lost in your Christmas decorations, then hanging is a really good option. Okay, so then once you picked your room, found a location and set it up, then we need some information from you. So as I mentioned, you are going to get a report of what the radon level is in your home. And so we need to connect the serial number that's on the detector with your name, your contact information, your address, and then the date that you started the detector. And so on your information, there is a QR code so that you can scan that, or there's a web link, or in the email I sent you, there's also a link. So you can use any of those ways to get to our start survey. And so if you click on that, that will get you to where you can record the necessary information that we need. And so as I mentioned, there's some required information. So your name, your contact information, your address, the serial number on your detector, and your start date. That's required information. And then it's going to ask you if you want to keep answering more questions. And so you can say yes or no. And then the additional questions are some survey questions that we're doing for research. So things like, how old is your house? Have you done any renovations in it? Those sorts of things. So if you would like to, you can answer those additional questions, but you don't need to. Now, some of you will have received 2 detectors in their package. And so, as Anne-Marie said, the detectors that you're receiving today are quite accurate. And we know that they're accurate because we do quality control checks on them. So one of them is we ship them to a lab and we expose them to a known level of radon, and then we compare them with what the lab analyzes them. But another way we do it is we send out 10% of our detectors have 2 detectors in it, or sorry, 10% of our packages have 2 detectors in them. And so we would ask that you would take these detectors and open them up at the same time and set them side by side. And so this helps us determine if they are measuring consistently, so how the precision compares. And so if you do get 2 detectors, then please don't share them with your neighbor or test up and down, but just put them right next to each other on that location that you've chosen, or hang them next to each other. And then on the start form, when you go to enter the serial number, it'll give you a location for 2 serial numbers. So if you have 2 detectors, you can put that in there. If you don't have 2 detectors, you can just skip the second serial number. Okay, so that's all the information that you need to set up your detector. And then that's it. You can enjoy life for the 3 months. And then at the end of the 3 months, there's a collection period. And so you have a location that you have chosen to pick up your detector. But when it comes to drop off the detector, you can drop it at any location. And so I'll go through those locations in a minute with Tyler, and he'll give us some instructions on those. But then after you've dropped the detector off, we will ship those to the lab, and then the lab will send you a report. And this is about what the report looks like. On it will be the radon level, which is the average amount that it was in your home when you started and when you ended the test. And that is confidential to you. But what we also do is we summarize the information. So here's a couple reports from other communities where we've summarized it up into a report. So we report on the number of homes that we had reports from, and the percentage of homes that were above 200. So you can see in this report, this left one is our updated one. The one on the right is a little bit older version, but they're the same information. The green homes are the ones that are below 100. The yellow represent the homes that were between 1 and 200, and then the red represent homes that were above 200. Okay, now one important thing that we wanted to note is that emails are often not going through. So we do send you emails to remind you. So if you got our email, that's probably why you're here. But if you're watching this because on video because you missed it because you didn't get the email, then this might be why. So please make sure that you add info@takeactiononradon.ca to your safe sender list because we will send you reminders to start the test. We will send you reminders when it's time to collect it, and then we'll send you your report and things like that. But we do find that emails get missed. Partly just we get so many emails that they get missed, but also because they go into our junk folder. So we'll just ask that you check in on that. All right. Okay. So you have signed up for a specific location. So your name will be on a list to go in and pick it up. And in your email reminder that you received from us, that you should have had a location. So it should have shown up in that email reminder of where. But you can certainly reach out to contact us, and I'll tell you how to do that in a minute. But starting tomorrow, you can go in and pick it up from one of these locations that you registered, and then we've got the hours here. So Tyler, I'm just going to get you. Is there any special instructions that people need to know when they go in and pick up their kit?
Yeah, just a few quick notes. If you plan on coming to the Fergus office either tomorrow or on Tuesday next week, our reception is closed, but someone from my team will be there. I'll be there all day tomorrow and a bit on the Tuesday. Just knock on the front door, and we'll be able to help you out. And again, a quick note: our Fergus office, we are closed between 12 and 1 p.m. So if you're going on your lunch break, we won't be able to help you because we're also taking a lunch break. And another quick note, we have our staff day next Thursday. So the Guelph and Fergus offices will be closed all day next Thursday. So do not plan on coming to pick up your kits on the Thursday. We will be open every other day though. Yeah, and just I was out driving around Wellington County delivering all of the kits. So just make sure you go to the location that you had indicated when you signed up. Otherwise, if you go to somewhere else, they won't have a kit for you. So just please make sure you go to the right place. And a note about the drop-in info night tomorrow at the Sportsplex in Fergus. You're all experts now on radon. It'll be the same thing. So it might not be the most valuable for you all to attend. We're just there trying to get take advantage of the foot traffic at the Sportsplex, talk to people about radon. We won't have your test kits there unless you indicated that you would pick it up at the drop-in info night. Yeah, I think that's pretty much all I had. And yeah, I'm trying to think of anything else, but no.
Perfect. Good. Yeah, thanks, Tyler. So the crews at these offices, the staff of the office will have a list with your name on it. I think we sorted it by last name so that you should be easy to find. And then you just need to record the serial number when you get in, or have them record the serial number. And the serial number is on the outside of the envelope. So right on the outside of the envelope, it will show the serial number for the detector that's inside. So you just need to write that down and then pick up your envelope.
And just a quick note on that, we went ahead and labeled all of the envelopes with everyone's names. It just helps the library staff a bit easier, so they can just grab it and hand it to you. So we have all the names corresponding to the serial numbers, so they don't have to record anything. They'll just have to check their name off of the list. So
perfect. All right, so even easier for you. Good. Thanks, Tyler. Good. And then, oh yeah, so that is, you go in, pick it up right away, but you do have until the 21st to pick it up. We do have wait list, and so we encourage you to go in and pick it up by the 21st. If you forget or miss it, we will be opening it up to the wait list after that. So after that, it'll be first come, first serve, in the locations that still have kits available. So please make sure you go in and pick it up right away. Okay, and then when it comes to return the detector, it shows you on the envelope the dates of the return week. So that will be March 2nd to 6th. It also shows you on the top of the envelope that date you need to start by. And so you ideally want to start it by a certain date so that you make sure you get that minimum 91 days in by the week of the drop-off location. And so we kind of put all those checks and balances because we know that people forget. We're human too. And so we try and really help you with as many reminders as we can. But if you are able to drop it off during the week the 2nd to 6th, then you don't have to cover the cost of shipping. We will pay for that. So we'll cover that for to the lab. If you miss that week or you happen to be away that week, no worries. You can still return the detector to us. And in fact, the detectors we're using this year are really cheap to mail. So it's just an oversized stamp, which is about $3. So you can pop it in an envelope and mail it back to us if you miss the drop-off week. The address is on the instructions. But the incentive of getting it back is gives you deadlines. It's helpful to remember, and then also it saves you that $3. All right, just a couple announcements before we get to our Q&A. So if you have any questions, please put those into the chat, and we will get Rashid and Anne-Marie going on some questions here in a minute. But I just wanted to let you know about a contest that we're holding. So the Take Action on Radon is a national awareness initiative to raise awareness on radon. And we have started the November contest. So November in Canada is the Radon Action Month. And so we want you to share what you know about radon and then with a friend or a community member, and then take a picture that represents it. So we've had some really creative pictures of people doing really great things to share their information about radon. And then enter the contest. So you can go to knowvembr.ca to enter that contest. And we've got weekly prizes of gift cards, so $50 gift cards for either Canadian Tire or Mark's Work Warehouse. And then we have grand prizes of a stand-up paddleboard, a Fitbit, KitchenAid, stand mixer, and then other gift cards. So great prizes. And to be honest, it's it's a pretty good chance to win because although there's a lot of people across the country that love to win these prizes, we have we'll just say you got really good chances to win. So certainly better than the number of people winning the lottery or the baseball 50-50. I know that was tempting at millions of dollars the other week, but this one will be a better chance for you to win. So you can enter that. And then there is also a Radon game there. So if you go to that website, you'll see the Radon game, and you can play a fun game, travel around a virtual community, and it'll ask you questions about which buildings you should test for radon. And you've probably learned all that information tonight. So you'll be able to play that game and you can level up. I think there's 3 levels and have fun with learning about radon as well. And then you can bonus entry so that you can enter the contest just by doing that. All right, and so we will share out this information, but we'll take time for questions. But anytime we are here for you. So we do give you our email and our phone number on your envelope. We certainly are busy through November, so it might take us a bit to get back to you this month, but we will give you a call back and help you with any questions. So if you do have questions, please make sure that you reach out to us. All right. Well, Rashid, thank you for joining us. I'm going to get you started with one of our first questions tonight. And so that is about the National Building Code. So if my house has one of those radon pipes in it, what do I need to do? Can you help us with that question first?
Yeah, thanks. And thanks for including me. Great work on the presentation. So yeah, if your home has a radon, I think rough-in is what you're referring to, or
Yeah.
I think that's what the question is. We would then recommend that you do the test. Do the test as per the instructions that were provided, and based on the levels, then you would make the decision if you need to contact a certified mitigator to then come see, and that pipe could then be turned into that active soil depressurization system if needed.
Perfect. And then another one that's somewhat related. What do I do about an open sump pit? Do you want to answer that one too?
Oh, sure, I can. That is one of the mitigation recommendations I think you covered, Pam, in your presentation. Is something that the mitigator would normally look at when they come in to find entry points for radon gas. And they would look at if it needs to be sealed and if there's any care that be provided to the sump pit. But first thing to do is to test, because first you want to know what your exposure is.
Perfect. Yeah,
Um,
exactly.
yeah. And did I see a question about Hamilton, or is that just in my
Yeah, I think I did see that
program?
too. My daughter lives in Hamilton. Is there a similar program where she could get a kit? Do you have an answer for that one, Rashid?
Yeah, do you mind if I take that one too?
Sure,
Because I
yeah.
was just talking to somebody too in Hamilton today, and we were looking for similar programs. And I think Hamilton participated in some great programs where they supported their residents, and the public health unit provided those kits themselves in the past. Um, Currently, right now, I know that Hamilton isn't providing that at the moment, but their library, the Hamilton Public Library, does have kits you can take out and borrow.
Yeah. Yeah, that's a good
The
point.
digital kits.
Yeah, the digital monitors. And so Anne-Marie had kind of referenced this, that the detectors that we're using in this program are a one-use detector. So they don't give you a number or anything until you have to mail it. It has to be analyzed and it comes back. But there are digital monitors out there that provide information on them. Yeah, there we go. Thanks, Anne-Marie. I was trying to find mine at my fingertips, but there it is. So Anne-Marie's got a picture on her screen that shows you an example of one. And so these are ones that have the numbers right on them. So you can set them up. They take 24 hours to kind of get to the point where they start to show you a number. And then you need to get, ideally should be as long as possible, but minimal 7 days before you start sort of taking those numbers seriously. And then as long as the library loan program will let you. So you would set that device up the same way that we've talked through setting up your radon detector, but you can borrow it from the library for a few weeks. Tyler, do you want to jump in on that one?
Yeah, for sure. We actually, working on the libraries with this, we just bought for the Guelph Library another 6 detectors because they had a backlog of just over a year. So we're helping to bring that down. There's huge demand. I think it was over 100 people on that list. So if you are looking to get a detector from the Guelph Library anytime soon, it's likely not going to happen. If you're in Wellington County, I think the wait list is a bit less, but they do have them at the various branches if you want to tap into that.
Yeah, exactly. So, which is why we're helping, 200 people with getting tested here, because we can get through them a little bit easier than the library, but that's certainly an option. So you can always get your name on the wait list if you do want to try out the digital monitor as well. Yeah, thanks, Tyler. That's great. Great to hear that you're getting more into those libraries because there is a good demand. We're seeing that across the country for those. Good. All right, Anne-Marie, I think we've got a few more questions.
I haven't looked. I was rooting around looking for where my digital was.
Or props. Okay. Oh, I've got one. Can the detector be placed in the closet? So we do not recommend that. Yeah.
That's a new question. No drawers, no closets, and not in the vegetable or cheese section of the fridge.
Yes, Anne-Marie had one detector put in the fridge for some reason one time and have somebody call her up wondering what on earth this was.
They thought it was cheese. They thought it was one of those like baby belt. Some of them are round. It looked like a hockey puck, so they thought it was a cheese.
Yeah. So you need to put it in a location where you spend 4 hours a day or more. So I'm assuming that you do not spend that time in the closet. So don't put it in the closet. Put it out in the main spot of the room. The other thing we also like to warn people is there is this tendency to want to find the radon. So people sometimes go down into the deepest dark parts of their basement where they're like, the radon is coming in there and I'm going to put the detector there, but don't do that. You want to measure what you're breathing. And so think about putting it in the space where you spend time and you're exposed to the radon because that's what we want to measure with this process. Yeah. All right.
Okay. I can take some questions. How long would it take to develop lung cancer? This is a good question. So just referring back to how do we know that radon causes lung cancer? In part, again, these were occupational cohorts. And the good news on that was that they could measure how much radon was in many of those workplaces. So on average, between 5 to 15 years is sort of the estimate of exposure. So this is not an immediate to life and health exposure. You do not have to evacuate if your home has a high radon level. If it is over 200, though, you want to think seriously about reducing the exposure to reduce your risk. So it's not an immediate problem. And there is some time for you to get a chance to fix it. But sooner is still better. And of course, the higher the level, the greater the risk and the more urgent it is to fix a home.
Yeah, another question, Anne-Marie, that along that lines that I'll throw back to you is about symptoms. Is there any symptoms that we may have that indicates we've been exposed to radon in the past?
This is a really good question. A cough, a persistent cough, and back pain are two of the hallmark symptoms of lung cancer. And I know those are also very common symptoms of other things as well. But if you are a person who is experiencing those two things, I suggest that you talk to your doctor about them. And then when you have your radon test results, you can also go back and tell your doctor about the radon in your home. Like, it's not just the public that doesn't know what radon is. The 50% of Canadians that still don't know what radon is includes people like doctors and lawyers and teachers and university professors. So we need to do more in Canada to raise awareness of this exposure. We're a uranium-rich country. We just are. And there is uranium, which is the parent of radon, all across the nation. And it's really important that people know, and it's important that people know what the signs of exposure are. So persistent cough, back pain.
Yeah. So yeah, lung cancer is really hard to diagnose, which is why we talk about prevention so much. Yeah, good. Another question about if we place the kit in the basement, but my basement is quite a bit colder than the rest of the house, would that affect the reading? And so if you don't use your basement, then I would place it in the space that you use. The temperature won't necessarily affect the radon levels, but the air movement would. And so if the basement is cold, it's probably an indication, and your rest of your house is nice and warm, it's probably an indication of how you're heating your home. And so the research shows us that if your house is being heated by a radiant type of heat, so like if you had a baseboard or a boiler or something that doesn't circulate it through the house, a non-forced air system, then there's actually layered effects of the radon. So it is coming through the ground. The highest level would be in the basement, and then the next highest level would be main floor, and then so on up. It doesn't mean that it stays in the basement, so the levels can be elevated all throughout a house. It just means that it sort of goes down as it goes up. However, in a forced air home, we are finding that the levels are even all the way through. And so typically, we're seeing that homes' levels are fairly even regardless of the floor of your home. However, in my house, I've been doing some research on these detectors, the digital detectors. So I've had them placed all the way through my home. And I have a 4-level split. So my basement is unused. And then I have like a sort of finished basement that's up a half floor. And then I have a kitchen that's up a half floor. And then our bedrooms are up a half floor. And my bedrooms are always really cold. So I close the return air in my basement level. And it's cold down there too. But when I place detectors all the way through my house, the basement was actually a little bit lower in radon level than my upper floors because the forced air system was pushing the air all the way through the house. It was probably taking it from the basement, but it wasn't getting pushed back in there. So that's just one example of a home, but it sort of fits what you're thinking. Is it colder? Well, it's not the temperature that would impact that, but it's the air movement. So it's possible that that may be why it's cold for you as well, is that there's no return heated air going back in it. So it's possible. But as we say, the only way to know is to test. And so if you're spending 4 hours a day or more in that space, even if it's colder, then I would recommend you still test. But if you don't use it, test in the next 4 up. Okay, long answer on that one. But another question is about a friend that lives in Ottawa, and is there a program in Ottawa for this? So, Rashid, I don't know, do you know any if Ottawa's doing anything?
No, I'm not aware of Ottawa doing anything. I do know some health units um, in that area used to provide
They have, yeah,
counted test kits,
yeah.
but I think one thing would be to call the public health unit to see if they still provide those tests.
Yeah, I was going to actually check back with Tyler too. Do you know, Tyler, if any of your public health colleagues are doing surveys this year?
None that I'm aware of. I know they pop up from time to time, depending on funding and
Yeah.
all of that. But yeah, nothing that I'm aware of right now. I can put out some feelers, but yeah, some health units are a bit more on top of it in terms of kind of radon outreach, and it really just depends on the health unit and what priorities there are at that time. I would just reach out directly to your health unit. That'd probably be the best bet to get a good answer.
Yeah, yeah, that's a great idea. We do on the Take Action on Radon website, we do have a provincial page. And so if we find out about programs, we try and put the information on there. But yeah, there was somebody doing awareness. Anne-Marie, who was that?
It was a public health inspector,
Right.
Little. Yes,
Oh, but we
Brian
don't
Little.
know which unit he was with.
No.
Yeah. No, there was an article recently in the news from a public health inspector, but they didn't identify if there was any programs in and or even which unit he was in. So yeah, as Tyler said, check with your public health unit. If you're not in Wellington, Dufferin, Guelph and accessing these, then you can certainly check. All right, it looks like we've got a couple more questions here. Rashid, maybe I'll throw this one to you. Should we keep our windows closed throughout the testing period on the main floor and the second floor? The detector will be placed on the basement, but I typically leave the windows open on the second floor through the whole winter. Well, that's a good one. What do you think?
Yeah, that's a really good question, and I hope I answer this correctly, Pam.
Yeah, well, we could discuss this a little
But
bit. Yeah.
I do feel because I do feel that we want the typical like living patterns
Yeah.
that you're capturing because you want to find out your risk to exposure with your regular daily activities.
Yep.
So as long as nothing's interfering with the detector itself, like it's placed near an open window. But then
Yeah.
if you do open your window a certain amount of times a day to do that, if you had an HVAC system or something and you're running it regularly, continue to do that.
Yeah, exactly. Yeah, yeah, no, that's great. Yeah, so test as you live. This is quite common that certain people love to sleep with the window open. And if that's what you do, then that's how you can test. Yeah, good answer. Oh, I was hoping we get this question, but I am going to throw it to both Tyler and Rashid to see if you can help me answer this. But do you know if the schools in the area have been testing for radon?
I'm not 100% sure. I actually just made a note the second I saw that question to reach out to Upper Grand and Wellington Catholic to see if that's been on their radar. And if not, I will definitely encourage them to look into that. So
Yeah, yeah, good. Rashid, do you have anything to add?
Wellington, but I do know when 2012 we came out with the first radon survey, Guelph area in 2015 picked up a program for testing. And I feel like they recommended some schools to be tested too.
Yeah, okay. There has been some. Anne-Marie, do you want to?
Toronto Public Health has
Yeah.
tested the schools multiple times, and there's been a few other communities, and the Catholic school system in Ontario has tested schools as well. Sometimes
Yeah.
it's a bit nimbler.
I had a great story that someone shared with me about a area that we're testing in Ontario. I think it was in the Ottawa, outside of the city, but the surrounding Ottawa area, that they were testing because one of the parents was really adamant and shared the information with them, and so they decided to test their homes. And it came back to us because we're always looking for people who are raising awareness and helping with that. And it was a great story that was shared last year or the year before. And so yeah, if you don't know if your radon has been tested, then you can reach out and see if you can do some testing in, or see if you can get them to do some testing in their school. So yeah, check with your local school. Yeah.
But I'll add to that too. There's not schools, but also daycare settings.
Yes, good point. Yeah.
In BC, we
Childcare.
have one region that they actually do, the public health does facilitate daycare testing too. And we have a quite high area. So it's possible, and programs can be started to check childcare facilities, especially if they're in basements, church basements, home basements, places where it's not uncommon to have childcare.
Yeah. Yeah, that's good. And workplaces too, which I think Anne-Marie had talked about too. So you can certainly ask about workplaces as well. I have one more question that typically comes in, and that's about a heat recovery ventilator. So we talked about testing is normal. So if you have windows open or whatever, then you test that way. But another question we often get is if somebody has an HRV or a heat recovery ventilator. So, does this reduce the radon? So obviously you would use that as you would normally use it during the season. So this is a system that is connected into your forced air heat system, ducting system, where it provides fresh air. So we're making our homes more airtight these days. And so this HRV allows fresh air to come in. And so it works so that it brings in the same amount of fresh air, and then it takes that same amount out, and it sort of does it in a way where it passes the heat, sort of recovers it. So it saves you money from heating. But what happens is there's a filter on the HRV. So when the air comes in from the outside, sometimes this filter gets clogged, or, and so not as much air is coming in than previously was, but the same amount of air is coming out. And so what happens is this can depressurize your home. And so we do recommend that if you have an HRV, that you maintain it and make sure that you clean those filters. But certainly if you do have high radon levels and you have an HRV already in the home, this would be one of the first things to check to see if it's out of balance. Then maybe you can balance it and test again. And in fact, if you have an HRV, we do recommend that you would just buy one of those digital monitors, because then you would monitor the radon continually, and then if it did get out of balance, that would give you an indication if it was impacting the radon levels. Okay, all right, last question. Will the kits be available to those on the wait list eventually, or do we have to do it on our own? And so, yeah, we have the kits available, I think, until the 21st, right, Tyler, for those on the registered list? Yeah, and then after that, we will email out. So make sure you add that info@takeactiononradon.ca email to your safe sender list, because we will check with all the locations after the 21st. So it'll probably be the following week that you'll get an email from us if there are still detectors left, and we'll send you an email to say it's, first come, first serve. So you're welcome to go in and get a kit. Great. All right. I think that covers most of the questions. Maybe I'll just check in. Rashid, was there anything else you wanted to make sure you answered tonight or were brought up tonight?
Thanks for checking in. I think we're okay.
Tyler, anything that you had wanted to make sure we got to, or any questions you were receiving from people in the community before this?
No, not that I'm aware of. But the libraries do have all my contact information. So if you want to reach out, you have questions about pickup or anything like that, they'll be able to help you out. Or if you just call the health unit and ask for me, they'll be able to direct your call. Perfect.
Good. Thanks, Tyler. Anne-Marie, anything else from you?
It's great that your medical health officer is taking this on as well too. I saw Dr. Mercer has been talking about radon. So yeah, that's fantastic when we see multiple levels of government getting involved. So between the libraries, I think public libraries and public health make such lovely partnerships. So what a great idea, Tyler, to connect with libraries. Not everybody does, but I think it's just a really good way to go forward. It makes it much more successful. So thanks for hosting this for you and getting your community access to free test kits, because it's really important part of this journey. And thank
Yeah.
you, Bonnie. Is Bonnie still on the?
Yeah, Bonnie had to go. She had an event that she
Okay.
had to get to tonight. But yeah, we also want to thank Bonnie for the courage it took to share her story and for reaching out to us and sharing it. So yeah, we really appreciate hearing from Bonnie, and thank you to her for sharing that. And thank you for all for joining us tonight. We love connecting with communities, and so we really appreciate the opportunity to share a little bit about Radon with you. We encourage you get those tests, pick them up, but also share your information that you've learned tonight with your neighbors. We need your help with getting radon awareness out across the country, and so you can help us with that. So again, thank you, Rashid and Tyler and Anne-Marie. Really appreciate all your support tonight. And thank you all for testing your homes. Have a great evening.